Good evening, everyone. Thanks for joining us this evening. My name's Tara Evans, and I'll be hosting this evening. I work within the Division of Tropical Health and Medicine as a Manager of Partnerships and Project Development. Joining me this evening will also be Professor Richard Murray. Now, before we get started, I'd like to just pause for a moment and take the time to acknowledge the Australian Aboriginal and Torres Strait Islander people on the land in which we're meeting today. I'd like to pay my respects to elders past, present and emerging. And for me here in Townsville, that's for the Wulkurukaba and the Bindal people. In the interest of reconciliation, I'd also like to take the opportunity to just pause and recognise the valuable contributions that Aboriginal and Torres Strait Islander people make to James Cook University to this day. Now, as I said, tonight we are joined by Professor Richard Murray. He's the Deputy Vice-Chancellor within the Division of Tropical Health and Medicine. We're going to be discussing a wide range of career options across both human and animal health industries. And we're also going to have a chat about the JCU application-based program within medicine, dentistry, and also veterinary sciences. We're going to have the Future Students team on hand today to answer any questions that are going to come through on the chat. On that note, a little bit of housekeeping. If you do have a question, please just pop it into the Q&A box that you can see on the bottom of your screen. The team will be able to ask any questions of you, and if there's anything in particular of interest, we'll also be able to answer those questions live. So, without much further ado, I'm going to hand over to you, Richard.
Thank you very much, Tara, and good evening all, wherever you're tuning in from. I gather we have quite a lot of people on the video hookup, so delighted to be here tonight and to have the opportunity to talk you through the various options for those of you who might be considering a health career. I'll just begin by noting some of the things that maybe are a bit distinctive or interesting about health careers and study, education and training that you might pursue through James Cook University. So firstly, we're often known for these themes. So we really believe in and are very passionate about rural health and remote health, isolated health, Aboriginal and Torres Strait Islander health, obviously, Indigenous health, First Nations, and also the tropical context. So that's the tropical world, Northern Australia, but actually the tropical region of the whole world is a fascinating aspect that includes not only tropical populations, but tropical diseases. And maybe if you dig a bit deeper and say, well, why do you care about those things? And maybe many of you who are wondering about what to pursue in your lives, if this sort of idea appeals to you, then we're your people. So the sort of students who are appealed, who find JCU options in health and medicine appealing, are the sort of people who find these ideas speak to them. So the notion of study and a career with adventure, skills, and impact. And what do we mean by that? So giving students experiences that are going to stretch them, broaden horizons, give you stories to tell your friends and family whose mouths might fall open at the amazing things you've done, to undertake placements as a learner under supervision and in a structured way, but perhaps in some pretty exotic parts of Australia and the world once the travel restrictions open up. So normally that would be indeed very much a part of what we do. Skills, we really take seriously the notion that we're in the business of providing the young professionals who are going to serve the communities that we feel a commitment to. And a big part of that is actually making sure people are thoroughly skilled up. And that means we've got some of the, if not the highest, some of the highest practical experience of any graduates in our programs in the country, because we really care about people leaving the programs feeling super confident, haven't just read about it, haven't just done it in a simulated lab, haven't just seen someone do it. I've actually done it myself, and actually I'm pretty good at it. And that's what we believe in, real hands-on skills. And finally, and perhaps most importantly, And even if it's just a spark at this point in your study and life and work, if you harbour a little ambition in your heart to be the sort of person that's going to make a difference in the world, and maybe particularly make a difference in the world where communities really need them, then again, we're your people. If, however, you want to pursue making a lot of money, buying a Lamborghini by the time you're 30, and climbing a greasy pole, we may not be your people, just saying. So you get a sense, perhaps, of who we are and why we might appeal. I don't have a Lamborghini, just saying, Tara.
To know. Thanks, Richard.
Yeah, thanks. So look, a career in health, it's a really something that probably most of us might consider. I was myself originally interested in science and things, but I really like people, and health careers really bring those things together. So it's a passport to a rewarding career, and in many ways, no matter what you pursue. So it is about solving people's problems, including people's problems and animals' problems, and people's problems with animals. And so we are considering, we'll talk a bit more in a moment. Health careers, human health careers, it's Australia's largest and fastest growing industry. I guess that's been a bit underscored, hasn't it, Tara, with some of the
COVID.
testing of health systems in countries that have really suffered from the impact of the COVID-19 pandemic. And that those phases are probably coming in this country. And so, well, indeed they are. Hopefully many more of us are going to be vaccinated. But this is serious stuff in healthcare, and particularly with aging populations, disability, the challenges of making sure that we've got the health professionals working in the right place with the right skills, doing the right work. And I guess as well, and we've really seen this with the restrictions on travel into the country associated with COVID, that we've had a reliance in a number of health professions, medicine, but also nursing and dentistry and some others, an undue reliance on bringing people in from overseas to fill gaps in the healthcare system. So that's going to be a lot more in the future provided by domestic graduates. And so it's certainly a very safe career.
Yeah, I think I'd add to that, Richard. During lockdown times, or when businesses are really constrained, and unfortunately there's been quite a lot of that lately in Australia. It's been the healthcare sector in many respects that is, yes, they're very impacted by it, but they've got that job security, they've got the stable income, and that's sometimes careers that people might not think of, like pharmacy or those sorts of things.
Indeed, I'd agree with you, Tom. And here's just a graph to prove that I'm not just making up stories. Entirely unreadable, no doubt for you, but so this is from the Australian Government's National Skills Commission, some data projecting employment growth to the 5 years to November 2025. And it won't surprise you, because we're telling the story about healthcare jobs, that by far and away the largest growth in employment prospects in the economy is projected to be healthcare and social assistance, accommodation, food services, professional, scientific and technical services, education, training, and so on. And then right down the other end, things that still wouldn't want to turn people off, but not surprisingly, manufacturing, media and telecommunications are some of the areas that are declining a little bit. So healthcare is a really safe bet for careers if that's what you're interested in. So look, we're really turned on by the idea that we're going to work with, in, and for vulnerable and underserved communities. We really like the idea that you can pursue a career that not only provides you with a job and a financial reward, but also is fulfilling and gives you professional satisfaction and a sense of having an impact in your life and your work, as well as providing graduates really with a wide range of choices in what they do. Again, the question of fit for purpose. We really want to have being part of making sure that the communities we care about have an opportunity to benefit from graduates who really like that sort of work in health and medicine. Skills and confidence we've talked about. Comprehensive curriculum, deep science, and extensive supervised practical experience, very important to us because of the above. And And whilst we are very famous for providing graduates who go on to adventurous careers, rural, remote, tropical, indigenous in Australia and the world, our graduates are also, interestingly, in great demand in the city, because guess what? Highly skilled, confident, well-prepared people go anywhere and make great employees. So thank you. Many of you may be from Queensland. Many of you might be from all around the country. Perhaps there's some who might be dialing in from elsewhere in the world, but we occupy, in terms of the communities, we have a relationship with a very large part of the second largest state in Australia, Queensland. And that little grey bit down the bottom is the bit where we're not. And all of the orange bit is the bit where we are. Our two major campuses in Australia are located in Townsville and Cairns. We also have a major campus in Singapore, and indeed we have a campus in Brisbane in partnership arrangements. We have many local study centres and locations of all sizes in substantial regional cities such as Mackay, in a fantastic location like the Torres Strait. We're actually on Thursday Island, believe it or not. Students love placements and adventures in these locations, Tara. And all parts, Mount Isa is an important part of it out west. And indeed, particularly with our general practice training, we're located in a variety of areas in more southwestern and south coastal Queensland. Again, all regional Queensland.
I think we've got some great pictures coming up and a sort of video at the end that actually shows some of the students on Thursday Island. So that'll be a treat for people that stay right to the end. Okay, so I'll talk at the beginning, because it's obvious, it's often something that's of particular interest to people who are wondering how they might win the race, really, can I put it that way, to get in to some pretty competitive entry programs that are very popular with us at James Cook University. So the medical program called a Bachelor of Medicine and Bachelor of Surgery, that's the title. And this is a comprehensive 6-year program. It's extremely well subscribed, and we have a selection process we'll go through, and you need to make application in a particular way to get into that through QTAC as well as direct to the university. Similarly, the Bachelor of Dental Surgery is a very popular, highly subscribed program, and indeed the Bachelor of Veterinary Science Honours is again a very subscribed program. So there are some particular things that we'll talk about in a moment, and let's go through them now. The Bachelor of Dental Surgery. Now, before I get into that, don't you like that picture there, Tara? So people may not realise that. I'm just saying that's not a real person, just in case you're wondering who that bald person being. This is some of the amazing equipment that we have. We've got a fabulous large green building in Cairns that not only is a very busy dentistry clinic in a lovely tropical location nestled in the rainforest, but actually we've got these extraordinary simulation facilities, which, as you can see there, is one of our students doing their preliminary practice work on practice teeth and a practice head in a setting that's absolutely like a clinic. And believe it or not, you can get teeth from the dispensing machine. I was going to say, that's I think still one of my favourite things about going to the dentistry building is you walk straight into a vending machine filled with fake teeth that can go into SimMan. So
wave your credit card here, get a practice tooth and go and practice on it. So
drill away. Yeah.
So that's fabulous. And it does mean that the very early clinical experience people get, that they come in really well practiced, and we have a lot of clinical experience, but it starts out with practice teeth in practice heads. You do need to do, like as with the others, English, mathematical medicine methods and chemistry or equivalent, and having at year 12, and we do. Again, we could talk about that in a moment.
Yep, successful completion, I think, at year 11 and 12 level.
Yes, thank you.
For those. So
yeah. And for these, all of these written applications, actually, the academic performance at year 12 studies or in subsequent tertiary studies, either in whole or in part, and we get that data through QTAC, Queensland Tertiary Admission Centre. I think that's right.
Yep.
I only know it as QTAC, just saying. So it's the government auspiced admission centre through Queensland for universities. We evaluate the written component of an application form. So that's special, and you do need to write down why you're interested in this. And in addition, for the medicine course, the Bachelor of Medicine, Bachelor of Surgery, there is for those who get through a certain quantity, we will then conduct interviews. We run at the moment about 700 to 800 interviews a year with panels of community members, academics, and health professionals. And then those things are combined to result in whether somebody gets an offer. You have to apply through QTAC, the general tertiary admission application that all of the universities use in Queensland. In addition, for this course, you have to make a written application for dentistry, veterinary, and pharmacy and medicine, a written application to Jcu as well. And then for the medicine program piece, there is also, for a selected group, an offer of interview, and then a subgroup who get an offer of a place. That's how that works.
We've got an
So
important
here's some key dates, Tara.
Very important. So we've
I
got the
won't read
domestic
them out
applicants.
because that's boring, but they matter.
Exactly.
Don't miss the dates.
Don't miss the dates, and
don't miss the
obviously
dates.
notice the domestic applicants and international applicants, they are slightly different. Obviously jump onto the JCU website if you're looking for more information.
And you know, a big star in your diary, and one in your, maybe your most loved person, or your mum or your dad or whomever, so it's in their diary too. Don't miss the dates.
Yeah, that's right. I think just probably the only one to put to people's attention for those applying for medicine, the December interview dates obviously will come through in mid to late November.
And which is also why, and probably this won't be an issue again this year. Don't book your overseas holiday if you're potentially going to be going for interview in December. So being available, Tara, is probably one of the things to keep in mind in relation to medicine interviews. Thanks. Okay, let's dive in a bit further. The Bachelor of Medicine, Bachelor of Surgery. So look, everyone knows who a doctor is. Here's one of our graduates, Michael McLaughlin. He completed his Mick. He completed his medical degree with JCU. And we'll talk about how medicine works in a moment, but he then went on and completed his internship and then went on to train as a specialist general practitioner and is pursuing a career now doing this broad skill set medicine that we now called the old do everything medicine, you know, the old-fashioned country GP in a way, but now called a rural generalist. He's doing that in the Burdekin region, in the Air Hospital. And he talks a bit there about the breadth of his experience, procedural and in general practice and emergency medicine. And he just, it's one of those things that what appeals to him about that, as it did with me, and this is my own area of specialty, doing a skin check, he says, and taking someone on a melanoma journey, but also being able to do just about everything else as well. And how you combine, again, that interest in biology, helping people, science, healthcare industry, you know, healthcare systems and so on, that really broad breadth. I have to say too that our graduates do just about everything else as well, from high-end technical science, international medical careers in neurology, for instance. I'm thinking of one of our grads, to orthopedic surgery, to just about anything that you care to name. But about half of our grads go on and pursue rural medicine and general practice because they love the breadth.
And I think that's a nice segue, Richard. I'm going to jump into one of the questions that's been asked by the audience. And can you help to articulate, you know, what's the difference between actually doing the Bachelor of Medicine, Bachelor of Surgery at JCU versus, say, doing the Doctor of Medicine at perhaps another university?
Yeah, look, what's the difference in brand? That's a great question. You could have a long answer or a short answer. We've had a crack at a short answer.
Well, we're already 7:30, so
that's right. We'll have to. Okay, so the short version is it's a medical degree. It probably doesn't matter in terms of, for instance, going on to do specialty training afterwards or pursuing a research career or whatever. No difference. Literally no difference in terms of prospects.
Either will get you there.
You're a registered medical practitioner straight out of medical school. with still wearing short pants or skirts, really, but whatever. You're still a learner at that point, in a sense. And what happens afterwards, as you work through hospital training years, subsequent specialty training, is much more important in terms of what you do. And indeed, you're pointing this out, aren't you, Tara, that this is what that is. Probably the biggest difference for JCU, it's a proper full year, 6-year medical degree. So there is just the headroom to do everything in depth. A 4-year program in medicine, you still come out with a qualification, but you just won't have done as much. And that's fine, you'll catch it up. It's still counted as the same. But in terms of opportunities for practical experience and depth, there's a lot to be said for a 6-year program.
We've got a slide coming up with a bit of the course structure shortly,
Yeah.
so that'll also, I think, help people to understand the real difference.
You can see here too, we're actually directly involved, quite apart from anything else. We're directly involved, and not by accident, because we've been great advocates for this in the med school piece, but also the bit that goes on after med school when you're not perhaps quite sure what you're going to do, and you can taste and try a few items on the menu as a junior doctor. And then heading on, we actually deliver, as I mentioned, specialist general practice training across 90% of Queensland. We're the only university to do that. But our graduates, as I say, go on and do everything else as well. There are about 68 medical specialties, believe it or not. I won't name them because that'll take us through till 9. But there's a Chinese restaurant menu full of medical careers.
And I think it's an important understanding because, as we know, not everybody realises that general practice is a specialty within medicine. And so, when you complete your medicine degree, you aren't guaranteed, straight immediate entry into becoming a general practitioner. You actually have to apply through colleges like you do with other specialties as well.
That's right. So medicine, there's if you like, I'd call it, we sometimes say it's an overlapping wedge, though the early part, obviously, much more campus-based, much more theory, early practical, though, and people are doing placements from their first year. In fact, there's a very large rural placement in rural clinical practice in second year, which people love. And partly because there's such inspiring people to learn with and from, doctors, but also nurses, allied health practitioners, community people, Aboriginal health workers. It's quite a transformative thing. But obviously, the further you go through the program, the more it becomes practical and applied. And indeed, by the final year, the students have completed their big exams, really, and it becomes a pre-registration year where a lot of what you do is within healthcare teams in all sorts of environments, rural, large hospital, emergency, and so on. And you're a valued member of the team in many cases, contributing to healthcare as a learner prior to graduating. It's part of how we make sure that our graduates are really well prepared.
And I think it's probably not clear in those early points, but, yes, as you said, it's mainly theory, but you are in the sim labs, you are working with some of our volunteer patients and doing sort of mock presentations and things like that. So whilst you might not actually be in a hospital or in a clinic setting, you're definitely getting that hands-on experience.
True, and look, can I say, I just love our volunteer community. It's one of my favourite bits, and we have about 200 between Townsville and Cairns volunteers, fabulous community members who are just so enthusiastic about being involved and who lend their bodies and their brains to the business of students practicing with them. It's fabulous.
The acting skills sometimes.
Acting skills, exactly. You come into the program at the moment, this is the structure into Townsville based, but there are some placements away from Townsville, as I mentioned. From really the 4th year on, there are opportunities to be based in either Townsville or Cairns, and indeed from 5th and 6th year on at the moment in Mackay, Townsville and Cairns as a base, but also with opportunities to undertake placements away. Not actually in Darwin, we must correct that, but there are opportunities to do electives, things that you might wish to do, really pretty much anywhere in Australia or anywhere in the world when you're allowed to travel again, which I'm sure by the time anyone on the video conference tonight, webinar tonight, things will be sorted by then. I'd be really disappointed if they weren't. So it'll be back to normal.
But I guess in essence, it's this huge number, 4,300 sort of hours in clinical sort of placement time.
And to give you a sense of that, Tara, the variance in this is, from under 2,000 hours of practical placement to over 4,000. We're the over 4,000, just because you've got the headroom to do that.
Yeah, definitely.
Jacinta, I remember Jacinta from when she was in second year. She's now a fully qualified general practitioner, an Aboriginal doctor. Indeed, she had an opportunity to be part of some research work that I was involved in the far northwest of Western Australia, in remote community with exposures to asbestos as a third-year student. I remember her well. And it's fabulous. We now employ Jacinta part-time as in the academy. She's involved in general practice training general practitioners. So that's a great story, isn't it?
Yeah,
she's fabulous, and a better doctor you honestly couldn't find.
Yeah.
Bachelor of Dental Surgery. So look, we've seen the head on the stick there before, and perhaps one of the things people don't realise is that not surprising, because you've heard a bit about us, that we are really keen on dentists who love public health, who are really into underserved populations, who like the idea of a career with adventure. And that may not be the first thing that you think of when you think dentist, because you think small room, antiseptic, a high-speed drill, and occasional screams. No, kidding. Modern dentistry is painless. That's part of the skill. But really, we really have students undertaking the most extraordinarily adventurous placements in remote parts of Australia, including the Northern Territory, Tasmania, remote communities, large training base in Cairns, but also overseas. And a big part of our placements have been into, for instance, the Solomon Islands. There's a student here talking about their experience in Cambodia on placement, and learning about, being part of trying to alleviate dental and oral health issues in a low resource setting, and really feeling very passionate about that as part of a career. So again, you can feel the brand, can't you, Tara?
Oh, definitely.
That's the sort of people, that eye-opening experience. Great shot of the tropical locations, the wet tropical locations. We have dry tropical locations too. But that idea of working in a breadth of settings, in adventurous careers, doing things in a voluntary capacity, whatever, it's really the sort of thing we do provide opportunity for.
Now, it appears that a slide's dropped out from the presentation, but can you give me a rough idea of, say, the structure of the dentistry program?
Sure. So it's a 5-year intensive program, again, based in Cairns for the early part of the program, a little bit like the medical program, which is based in Townsville for the early part. It involves, again, quite a lot of the fundamental theory and anatomy. The anatomy in this case is a bit more focused on the head and mouth, but is comprehensive too, and all of the fundamental science that you need to know as a health professional, including how the body works, how medicines work, and so on. But very early practical experience. Again, same theme in the lab, the simulation centre, but actually very early practical experience with patients, and that starts from third year. The thing about dentistry is that dental students do what my colleagues call destructive, irreversible procedures on teeth. You can't say, "Whoops, sorry, I'll do that one over." So you do need to be preparing people, and we really believe in that. Honestly, by the time they graduate at the end of the final year, which is which is comprised almost entirely of practical service in clinics all over the country, people are absolutely roadworthy and very much in demand as ready to rock and roll registered dental practitioners. And indeed, in dentistry, you're out there then with license to drip. I'm going to tell a bad joke. License to drill.
Here's a pun. Yeah.
Sorry about that, Tara. I won't do that again.
And I think the facilities on the Cairns campus, and even on Townsville, there's this beautiful clinic that students get to actually do some of their placements in, and a huge. I think it's probably the only dental surgery that I've ever been to that actually looks out over the rainforest.
It's amazing. Floor-to-ceiling glass looking onto the rainforest. It almost makes you want to open your mouth. It's fabulous. Thanks. And now to the other animals. Homo sapiens does tend to get a bit of a star billing, of course, in health careers. but there are many other animals, and oftentimes people may not have considered a veterinary career. People are quite involved in the business of animal medicine, often because they own them, or care about them, or want to protect them. And so, for instance, companion animals, obviously people know, cats, dogs, rabbits, guinea pigs, you name it, people own them. And so companion animals medicine, small animal medicines are obviously part of the veterinary practice that people are most familiar with. But livestock or production animals, the large and small, is a big part of what we do. A lot of veterinary practice these days has tend to drift a bit more towards the companion animals. One of the distinctive pieces about our veterinary program is that we still have a very strong focus on large animal, production animal, or livestock animal medicine, and be that cattle, sheep, horses, goats, pigs, whatever that might be, very important for us. And indeed wildlife, and people often don't realise that. I mean, we for instance in the veterinary program we have a turtle research area, and we have leatherback turtles with radio transmitters glued to their backs, and all sorts of interesting things. And so
right here on
aquaculture,
campus.
as well as terrestrial animal agriculture, it's quite a broad program. It's a real generalist equivalent, isn't it? It's like the generalists we were talking about in the medical course before. Same thing. And very diverse opportunities for employment. Bit of a quote there from one of our grads: much more mixed practice, this graduate says, and that was the real draw card. And I think that probably is right. And being a good vet and having staff that go above beyond, volunteering as a student with the Equine Veterinaries Australia Conference, this particular student really enjoyed. And that's something we're really famous for with the vet program. That's why it's so popular.
I just love that here in Townsville, again, you can walk across the bridge to get to the vet campus, and there's cattle yards right there, and
right.
There's horses, and they're right here. You wouldn't realise we're just across the road from the hospital.
And I have to say a little story. Also in our poultry and other livestock holdings, one of the hazards is that the pythons get in. They come in from the scrub. Just saying, people. We're in a regional location. Thanks. And there's a bit of detail there, Tara, about the structure of the course. Same sort of theme, isn't it? So again, early clinical experiences, but with much more theory and prac-based. Fantastic anatomy labs. Anatomy labs, if you don't realise, in a vet, particularly where you're doing large animal vet, you have to have a crane. So we do have cranes in our veterinary anatomy labs to lift animal carcasses onto the plinths. Obviously, early practice and immersion, and that's years 4 and 5 of the program, is where people are much more involved in the direct delivery of services to animals and their owners and the people who care about them. So communication skills, not so much for the animals, just saying. You do need to know how to calm animals and be safe with them, be it a cattle crush or a cat that might bite. But also the owners, and communication skills very important. Thanks.
And similarly, that final year is very much hands-on, as it is with medicine and dentistry.
Great photo there, isn't it? So yes, to someone else, Aaron Lau, talking about the adventure, the places that Aaron's been. Rural focus, exploring parts of the country that I would otherwise never have travelled. I mean, how fantastic to get into stock camps and in remote cattle stations, to be part of, let's say, wild pig hunting and some of the disease control and other things. Fascinating work.
So we're going to jump into some frequently asked questions, and I can see that there are quite a few questions coming through on the chat. So, we'll jump in. Hopefully this will answer some, and if not, we might delve into some of the questions that are being asked. So, do people need to sit their med entry test like you?
That's an easy one. No. No. No's the answer. It's easy. Move on. No.
Move on.
No,
next slide. Yeah.
So I've explained in relation to the med, the used to be called UMAT, it's now called UCAT. we do not use that for any of our courses. We use the high school equivalent or secondary school equivalent scholastic achievement or academic scores, and at the end of year 12, or academic achievement in subsequent tertiary studies for those who do that. We do not use UCAT, or UMAT is the other version for graduates who might be interested in pursuing the medical course.
And so the next big one's around, can I transfer into my preferred course from another JCU course?
Yeah, look, it's quite a common pathway, Tara. So because it's so competitive, people may not get in on their first round, but if they're really determined, I think it's still worth keeping that in mind. And people will often think about pursuing, taking up another health profession, and there are great choices. Another either health profession, a qualification, or let's say a biomedical sciences or a Bachelor of Sciences, a science degree. Pharmacy, for instance, med lab science, for instance, too. So these are quite common ones, and people will pursue those, aiming obviously in their first year of study, perhaps their second year of study, to get really good grades, and then be more competitive, perhaps in academics for a subsequent transfer across to med. It's quite a common pathway for us, and we certainly have a lot of students come in successfully into the tightly contested programs, having done a year or two in another program. It's a good question.
And I guess I often, if I'm ever speaking to prospective students, I sort of encourage them to try and think about what it is that's drawing them to medicine, and consider that in their sort of, whether that be their second preference or what have you. Because I think that's, as you said, it's really about getting good grades. And so if you're not doing something that you actually enjoy and could see as a potential career path, then, you're not going to be as successful as you might want. And
it's
so
hard to be motivated,
isn't it? Most
if it's not something you really can care about. Yeah,
and we've had many examples of people going into a program thinking, I'm going to divert and try and get into medicine, and then they get in there, say in the pharmacy course, and they do it and they love it and they stick with it, and it's just one of those things that they hadn't considered.
Thank you. It's true. So look, now we're going to have a bit of a skate across other choices, because that's a bit, we've spent a bit of time focusing on the competitive ones, and I suppose that's often why people have we need to spend time, because there's questions about it. But it's really important to realise that healthcare, I talked about Chinese menus before, it's really true. There is a spot for everyone, and a lot of these people everyone knows about, maybe are considered nursing or midwifery. They've seen that, heard it, won't know people. And they'll tend to often also know, perhaps pharmacy, and often been to maybe a community pharmacist, but maybe not know other aspects of pharmacy. But there's lots of others too, and let's spend a bit of time talking about those, so that you've got a bit of awareness of the menu in pretty diverse choices. And let's start with medical science careers. So we offer really three options here: the Bachelor of Biomedical Science, a Bachelor of Medical Laboratory Science Honours, and a Bachelor of Clinical Sciences Honours. And let's have a dive in there. I have to say, here's a fantastic colleague that you've got a picture of, if you might go back just for a moment.
Yes, yep.
Jeff Dobson, so interesting. Here's a guy who pursued he's so enthusiastic. His interest in understanding in fact the sort of, I'll call it hibernation, because people want to understand that, but how do little animals turn down the thermostat overnight and slow their heart rates down like a hummingbird, but then pick up in the morning? And isn't that interesting? And gee, might that be interesting to pursue in a science thing? And guess what? He's pioneered this amazing research that has a relevance to transplants, to trauma, that's undergoing international trials, having gone through animal trials. So interesting, but it grew from an interest in foundation science. Such an excitable fellow.
And I think, if memory serves me correctly, his background was originally, I think, in sport and exercise science or something. He isn't a clinician.
So Bachelor of Biomedical Science, here we've got Eva Duck talking about her work as an employee in the Australian Institute of Tropical Health and Medicine, and what she's doing in trying to understand the biological basis of disease, and in this case, different combinations of drugs to treat bacterial infections, and understanding the mechanisms of that, and the cutting edge science and development around that, and understanding in depth how the body works. in these real frontier areas that many of us are understanding more because we've been watching the science a bit more with COVID vaccines, haven't we? So molecular biology, computational modeling, immunology, and so on. These are some of the fields that people study. And it's about discovery and being at the cutting edge. And it's not just in healthcare, because the food industry, scientific sales and marketing, people often don't realize, say, in the pharmaceutical industry, biotech, diagnostics, a big part of this, development of new drugs and treatments, pharmaceuticals, many careers that can be used with biomedical science. Another grad talking about opening up doors and possibilities. Here's a research team here, Lars, who's got this amazing work. He's himself a fundamental scientist and now a scientific research leader who's leading international work on a new approach to tuberculosis vaccine. Believe it or not, the current vaccine that's used around the world for tuberculosis, TB, is over 100 years old, and we haven't replaced it. And so bringing cutting edge molecular science to a new approach to this is the sort of research field that's funded. And that's funded by Gates Foundation and international donors. Fascinating work going on here at JCU. Bachelor of Medical Laboratory Science, people might be a bit more familiar with this. This tends to be more directly in the healthcare industry. So a lot of people who have done some of the same foundations in learning about how the body works, and then pursuing often different interests in biochemistry, microbiology, histopathology, some of the areas, and there's more evolving as well, molecular genetics and other things. But these are the people who apply that expertise then to the diagnosis and the critical understanding of the use of diagnostics, and they're experts in the use, for instance, of machines and technologies in diagnosing disease. Clinical science is an emerging area. So again, there's a lot of the application of technology to the work that we do in health and medicine. And so you need increasingly large teams of people who are technicians and who have a fundamental science understanding, and who might be doing, for instance, heart diagnostics, understanding how well your heart is working, using techniques with patients, not just behind a lab door, stress testing, doing respiratory function tests, analysing sleep patterns. There's a whole emerging field in the business of clinical sciences that's around, that also involves patient care, but involves, again, the testing side of diagnosis and treatment.
And I think, again, for all of those, the previous three degrees that we've touched on, a huge amount, as we've said, of hands-on skills and really developing, I guess, their skills so that when they graduate, they're really confident working in the workplace.
And I think in clinical sciences particularly, because it's a much more front-end patient-facing. So things like, people might be dealing with a really bad news, that they might have cancer or whatever, and so being able to communicate empathically, have skills, observe carefully, and be part of a diagnostic process in a team.
Yeah.
Let's talk a bit about allied health careers. There are many, and they grow. As I said before, Tara, we might, pharmacy is often the one that people know. Physiotherapy, people will often know, especially if you've had a nasty sports injury or something like that, or you've had family recovering from stroke or a heart attack. So let's talk a bit about the allied health opportunities, and all of these are offered here. Nursing science and midwifery, not typically called allied health, but just for convenience, we'll put them under this heading. So let's dive into some of them, Tara. Occupational therapy, a Bachelor of Occupational Therapy with honours. Now, this is one that people often don't know anything about. And I'm embarrassed to say, when I was doing my medical training, I really didn't know much in med school about occupational therapy. When I was fully trained and working in remote Australia, I became a great fan of occupational therapy. And people think it's about jobs because it's got occupation in the title, and it certainly can be. But boy, is this one where you can just about do everything. And here's one of our one of our students talking about the range of areas. So mental health and counselling is something occupational therapists do. Working with kids in trying to help kids, particularly kids with chronic disabilities, being able to work better and function to their best possible extent. Aged care, community-based work as well as hospital, and also industry. So occupational therapists do also find themselves jobs in industry because they just know about solving problems, practical problems with people, either with machine splints, but also counselling and also things. It's a front-facing things. You can have a small business and be working independently, or you can be part of a big team in a hospital. It's a highly independent, problem-solving, generalist sort of a professional group in great demand, and increasingly so. With people might have heard of the NDIS. Don't you love these acronyms? National. The disability arena, big area of growth, and along with aged care, is really expanding occupational therapists and other allied health professions roles in supporting people to have the best possible life that they can. Here's one of our students, Mackenzie, who talks about valuable learning, expanded knowledge, professional development, and the practical placement side of it, which again, that distinctive aspect of our degrees, people heading off and doing things that are a bit adventurous, where they have a lot of hands-on, not just theory, and in small groups in areas where they're trusted to do things under direct supervision. They're not in some, I don't know, herd of students being sort of marshaled through a simulation facility. They're actually hands-on and valued for their contribution. Pharmacy. Again, people know about community pharmacy because you'll all have been to the pharmacist. And that's a great thing. And I have to say, it's a growing area. One of our graduates, quite famous graduates, is actually the president of the Pharmacy Guild of Australia. Our graduates really do go on and win prizes and take up leadership roles. We're great advocates of the expanding role of pharmacists, and community pharmacy included. So pharmacists these days are doing a lot more, including, for instance, influenza vaccines, treating minor ailments, being part of a team looking after people with chronic conditions. And so that's all true in community pharmacy. Also hospital pharmacy, and people are less likely to have seen that, being part of hospital teams, making sure that patients in hospitals are on the right combination of medicines. We call medicines drugs, by the way, don't get confused. We're not talking about the illegal type. And so being experts, consultants in the quality use of medicines in that setting. We've also been a big part of championing the new and emerging roles of pharmacists being embedded in primary care teams, for instance, so that you have a pharmacist, for instance, in an Aboriginal health service where there's very high levels of use of medicines with very relatively young people. We've done some great research showing what an impact a pharmacist can make working as part of a primary care team. And we'll see more of that into the future. It's certainly a big part of Pharmacy International.
Yeah, it's really interesting. I think, with the pharmacy program, there's just such a wide range. They can work with, in the emergency department, in the hospital, right through to sort of oncology. And as you said, there's a really wide scope of practice within
There's
pharmacy
also industry,
as well.
Tara, that people sometimes take up jobs, for instance, in development of medicines, so that more, the drug companies, they're called, again, not to be confused with the other sort, who develop life-saving treatments, and to be part of that as a pharmacist is another part of the job.
And really excitingly, we expanded the pharmacy program just this year, so it's now available in Townsville, in Cairns, and in Mackay.
Yeah, we like that, don't we? The idea of making health careers accessible no matter where you live, and it's a big part of what we're driving forward in making health careers available to people who might wish to stay in maybe close to the home if you're from those towns.
Yeah.
Great career choice. Shane Mcdonald. Now, look, I think Shane at the moment, if I'm correct, not only do we now employ him part-time as an academic pharmacist, and he's a great community pharmacist and pharmacy owner, but he's also a leader. He's the if I'm correct in saying, and forgive me if I'm wrong, Shane, I think he's the president of the Pharmaceutical Association of Australia Queensland branch. And so fabulous to have our graduates as leaders in the profession. Physiotherapy, again, great picture there, lots of fun. Great facilities, I have to say, we've got for practical training. And indeed, we run clinics where we treat patients, actually treat patients and help in recovery. And that can be sports, it can be stroke, it can be all sorts of things. Indeed, we've got really close relationships, for instance, with high-end sports, rugby league, for instance, let alone competitive sports, and the Olympics, of course, on at the moment. And there's a high-end sports really needs people who are expert in this. So look, physiotherapy, people know it, experts in the physical treatment of diseases, rehabilitation, and optimizing performance. Again, sprains, strains, injury, recovery, so on, associated with all of that. And there's one of our students who went out to Longreach, a small rural town, and loved that placement as part of his 4th year, seeing a broad range of presentations and doing a lot of things as part of the team, and physical therapy, very satisfying. You can often see real progress in treatment. It's very fulfilling to see people recover physical function and dignity.
Same quote as the previous one, yeah.
Yeah, trauma incidents, being part of recovery. Large truck, that's interesting. What you also get out west is coming off a horse, and things like that too. So it's fantastic variety. Psychological science, Bachelor of Psychological Science, psychology. So psychological science, studying the functioning of the human mind and its development. It's that which is normal and also that which goes awry. It's got a lot of application. People often think of a clinical psychologist, and that is indeed a qualification you can pursue after you do your base Bachelor of Psychology degree. You do a clinical psychology master's degree, and you're then a registered clinical psychologist. But psychology can take you a lot of places. For instance, there's a lot of demand for experts in the understanding of the human mind as it might apply in the workplace. There's an example, Tara, occupational psychology. There's forensic psychiatry, trying to bringing the law and psychology together to understand perhaps why it is through the criminal law process, what it is that might be part of people offending, but also being part of rejoining society after perhaps having done the time for the crime. You want people to be rehabilitated into society as functioning members of society, and it's a really important role for psychology. So very varied. Here's one of our students talking about being fascinated with cognitive neuroscience, and really understanding how the brain ticks at a more fundamental level, and how that finds expression in how the mind works as experienced by individuals. And so health psychology, environmental psychology, isn't that interesting? Cognitive psychology, memory, and so on, fascinating fields. Diagnostic psychology, that we've got great forensic psychiatrists who are able to administer really sophisticated panels of tests to understand brain function. And that's very important, for instance, in all sorts of settings, such as bringing people back into work, and so on, very varied application. Gee, working through the Chinese menu of health careers, speech pathology is again one that people perhaps haven't heard of. Very important when particularly children and language development, and how that can go awry, and the joy of working with children who might suffer a whole range of delayed speech, stutter, a whole range of problems that kids might have in relation to their speech development. Also, stroke and stroke recovery, Tara, where being able to recover the ability to communicate verbally has to be relearned. And speech pathologists are experts in that. And it's an important thing, including in education. Speech pathology often find themselves employment as part of in education systems too. So quite a varied range of career choices and opportunities in demand. It's not a big profession, but it's a highly valued profession. again, with that focus on speech, physically and neurologically aspects of speech and communication.
Again, I guess you've got that wide spectrum. You can work from children all the way through to the elderly, or those in palliative care, for example, and just people can really tailor it to I guess their area of interest.
Isn't that too? I love music therapy, music theatre singers, public speakers, and performers. It's fascinating, the breadth. Again, one people probably know, sports and exercise science, a little bit like physiotherapy, but not quite the same. Often a bit more focused on performance, but also recovery. And people pursue all sorts of careers. So exercise physiologists, strength and conditioning coaches, sports coaches, personal trainers, teaching. It's quite common for people to combine sports and exercise science with, for instance, a education qualification, so that you can work can bring that into the school in terms of physical sciences education as a teacher. So if you love the human body, its function and optimization, you're a bit sporty, then sports and exercise science is a great choice.
And if I'm not mistaken, there's a really good program with the Cowboys, with the sport exercise science program as well.
Yes, there is. Again, that question of optimization. I don't know if people know, but after these, brutal thumping sort of competitive high-end sports, dunking people into ice water with actual ice and getting maximum speedy recovery of muscles and ligaments is actually part of the science here. And there's a cutting edge of research in this too. So you often find that people in this area are also part of the research agenda in recovery from injury and optimizing performance. Now, the big one, the most important health profession in Australia by far, and actually around the world, is nursing, and it's the big one. And nursing is huge, and nursing is diverse, and nursing offers a much wider range of careers than you could ever begin to count. From the things that you might know of nurses, obviously on the ward in acute hospitals, the one that we tend to think of, to nurses in community practice. To nurses in mental health care, for instance, a bit like what we were talking about before, Tara, with psychology. Nurses in private, nurses are pursuing nurse practitioners these days with advanced specialised nursing, for instance, in cancer care or cardiac nursing. So there's a whole range of careers in nursing. It's big. Emergency medicine, emergency nursing as well. Here we've got one of our graduates, not the one pictured, I just want to note, just saying, who talking about working for this amazing varied, again, it's a bit of a theme, isn't it, with this emergency department, then 4 months in Doomadgee. Some people might know where Doomadgee is, but it's a very remote location with a very large component of Aboriginal population. And then working out at Mount Isa and really enjoying that breadth of experience and being part of a team and getting really to stretch yourself. That there's a very well regarded Tara for the depth of science and practical skills for the same sort of reasons that we've heard about before. The other one we've listed here is the combined degree of nursing science and midwifery, and a double degree. Now, you might know that in the rest of the country, and we're often seeing a bit of a separation between what have been often linked, midwifery and nursing. And you can pursue those these days as independent study and career. We offer one of the very highly regarded and very competitive programs, high quality programs of combined nursing and midwife. So you come out double barreled, which I have to say the world really still needs, particularly, not surprisingly, in remote and rural and underserved areas and in global health. The nurse midwife remains a really great thing, and to be able to do that in combination is still very attractive and there's great appeal to people, women and men, and nursing often thought of as being a predominantly female profession. We have loads and loads of men who do nursing, and it's a big part of the nursing workforce and pursued all over the countryside. So great option.
And I think that the science component, because often you'll have, say, a Bachelor of Nursing, whereas at JCU it's a Bachelor of Nursing Science,
Yeah.
because we really do have that strong emphasis on the strong
So
foundation sciences. Is that
if you don't
correct?
know the underpinning science, Tara, it's very hard to work things out. For anyone can, read a cookbook
Read a
and
chart.
read a chart and follow a protocol, but without an understanding of what's going on in the underpinning science, you can't work it out from first principles or go to the literature. And so we think that's really important in nursing, along with the practical skills.
Most definitely. We have had a question come through from the audience along the lines of, would say pre-study in nursing, or say a nursing degree at JCU, add any benefit to, say, further study into medicine at a later stage?
There are students who have, and look, it's that thing you were talking about before. If your passion is people, and you maybe think, gee, I wouldn't mind being a doctor, but I wonder if I'm going to get the grades. And you really want that diversity, remembering that in nursing, honestly, the sky's the limit. If you're doing advanced practice nursing as a highly skilled nurse or nurse practitioner, there's about this much difference between how that work feels to what a doctor in a similar area might feel. So it's very similar. And so it's quite a good choice for people who just know that that's what they want to do, that sort of work. But might want us to give an application to medicine a go. If it doesn't work out and you want to then pursue nursing, because you can see that pathway ahead of you to working in coronary care or working in emergency nursing or whatever, or remote area nursing is a big one for us. Then doing that's great. And yes, if you get really good grades and so on, we've got plenty of people who've got a great story of, I did a year or 2 years of nursing, and now I've successfully got entry to the medical degree. So I'm a bit sad about it, because I loved what I was doing, but I moved across into medicine, and so it is a good option, and there's plenty of people who've done it.
Thank you. Now, we're getting closer towards the end now, so I just wanted to let the audience know we will have an opportunity very shortly to answer some of your questions live. So be prepared on the keyboard with that. Obviously, we've got the Year 12 Student Success Package. Richard, do you want to say much about that?
No, you can talk about it.
Yeah, okay, great. Yeah, so look, for students that are currently in Year 12, there are some early offers that are available. If you're graduating this year, you may actually be able to receive an early offer for a course that you're interested in. So you can finish Year 12 with confidence, knowing that you've already got an offer into a course that you're interested in. We do have a guaranteed admissions plan also across some specific courses, and there are some adjustment factors that are available, such as the regional preference scheme and subject adjustment scheme. So if you're wanting more information about those, visit the website that is listed on the screen, or contact the inquiries team. We'll have their details on the screen shortly. Now, I just want to play a brief video for everyone, and this is a little bit about obviously studying at JCU and what that experience might be for someone. Always the test, which I've failed miserably. Let's see.
Some great scenery there, isn't there, Tara?
Yeah. So
Some
right
of that was
across our
TI
patch.
as well as out west, the first
Yeah,
island, I
Mount
should say,
Isa.
in the Torres
Yeah,
Strait, Mount Isa. Yeah, fantastic.
yeah, Mount Isa Rodeo. Lots of fun for people that haven't
And
been.
students really
Fantastic.
do go on helicopters like that. That's amazing.
Yeah.
Those who
Yeah.
go to the Torres Strait go to outer island clinics. It's very interesting.
So that sort of brings us to the end formally, and obviously we've got the opportunity to take questions from the audience. We've already had a couple come through. I might actually momentarily stop the presentation just so that we can bring up some more of the questions. But one really interestingly came through, obviously, with this increased demand of on the health system, Richard. There was a question around, will application numbers, specifically for some of the application-based program and in particular medicine, increase?
Yeah. Look, it's interesting. I guess we had that. We've had a bit of a first go at that, didn't we, last year? In that, I suppose, the first year of sort of COVID disrupted world, and there was, I reckon, probably a bit of a boost in numbers. Not so much into the competitive, highly competitive schemes, because they always attract lots of applications. So I wouldn't say dramatic, but probably overall, I reckon health careers picked up in numbers last year beyond other factors. We'll see at the end of this year. I guess we don't really know. I suppose people are seeing, businesses shutting down and being impacted by some of the economic disruption, I suppose, associated with lockdowns and restrictions on movement. That said, I suppose we also saw economic recovery being a bit faster than we anticipated. But then again, we're in lockdown again, or many parts of the country. So there's a bit of uncertainty, and I think flight. We've observed oftentimes in economic cycles that when the economy maybe goes soft and there's a bit of uncertainty, there will often be a bit of a increase in interest in health careers for exactly the reasons that you said before, Tara, that it does offer that growth and job security.
Yeah. And I think the other probably important thing is that the most programs at JCU are not capped. Obviously, with the application-based programs, there is limits on the number of students that we can take in. But for other health programs, there aren't caps on the number of students that we can accept into the program.
Yeah.
So I'm going to stop sharing there so I can jump in to some of the questions momentarily. So with rural placements, can students do some placements back in their home state if they wished?
Yeah, great question. So that's in most of the health professional programs, there's an opportunity to do something where there's a bit of choice, an elective or something of that sort. The medical program, for instance, has quite a lot of small town placements plus a substantial electives. And people may choose to put their hand up and go to either negotiate, certainly as an elective, which is in final year, or indeed in one of their small, if they're from a small town, then a rural town placement may be able to be negotiated at home. That said, sometimes going back to your own small town, if that's where you're from, may or may not be a good idea as a student in learning, and sometimes we'd want people to understand the implications, perhaps, of being in clinics or in hospitals where you're also potentially going to be seeing family, friends, and acquaintances in the clinic. But then again, that's small town work, and so we understand that that's okay.
Now, I had another great question come through in regards to, I guess, Bachelor of Medicine for this one in particular, but I guess it could span across, say, dentistry and veterinary science as well. Just interested if people are able to, or students are able to actually get involved in research as part of their degree.
Great question. We're really, really keen on this. So not only well, firstly, research methods and introduction to research is a core part of the curriculum for everybody. There is, as part of the honours programs, and you'll see that honours, people may or may not realise, means that there is a component of a project expected which is often a small research project or with that builds those research skills. There is also, in addition to that, opportunities that many enthusiastic students pursue to put their hand up and perhaps get a job as a research assistant or in a research lab or volunteer as a student. And that's really warmly welcomed. Indeed, I was speaking to some of our scientists in the Australian Institute of Tropical Health and Medicine who are just desperate to get into contact with students pursuing their health professional degrees who might be research interested, so that they can tempt them to maybe be part of pursuing that as a student. So it's encouraged. It depends a bit on your own interest and passion. And there is just about for everybody an opportunity to pursue, at least on some scale, a project of some sort, either individually or as a small group.
And fantastic, mentors, I guess, within JCU as well, in terms of the research space that students have the opportunity to work with. There is also a question around, is there any rural quota at JCU? So someone from Western Australia and asking if there is a limit or things like that on the number of rural students that are able to come into the program.
Yeah, so good choice. You might, or good question, sorry, you might know that in medical places in Australia, 1/4 of them that are funded by the federal government, 1/4 of the places are called a bonded medical place. And so that's about return of service. Sorry, there's also for those. Sorry, got slightly cross wire there. I'll retrace that set. That in medical places there is a expectation that a bit over 1/4 now of students coming into medical programs in the country are public medical schools are expected to be from a non-metropolitan background. That's an expectation on the university. That's, if you like, that's a quota. It won't surprise you to hear that JSU not only gets over that quota, but does so probably 3 times over. And so we don't have any issue with meeting the quota, and that's not the driver for us. In fact, we don't have a quota. What we do have is we're a brand that will often appeal to people who are interested in rural health and medicine, and many of those people may have a rural background, or even if they're from the city, maybe feel a bit passionate about a career with adventure and impact. And we also, as I'd mentioned earlier on, Tara, that we do weight the school achievement, academic achievement, based upon rural schooling. So that does tip the balance a little bit in favour of students who've done a lot of rural schooling, and the smaller the community, the more that weighting is. So if you like, the scale's a little bit tipped that way. So that said, that somewhere between 1/3 and 30%, or 1/3 and 30%, or thereabouts, up to 40% of students who come into the medical program will actually come from a major city. Brisbane, but also Melbourne, Sydney, Brisbane, Perth, Adelaide, or whatever, and are coming into the program often because they have a passion for it. They may have, many of them, been able to choose other programs because it's pretty competitive, but they like the distinctiveness of that which we offer.
There was, in that vein, there was actually a query around, are there also opportunities for students to do placements in metropolitan cities? Because obviously we spend a lot of time talking about rural, but the odd occasion in a metropolitan city, is that a possibility as well?
It is indeed. And probably the major one is the elective. So that's a long stint that can be up to 10 weeks. And oftentimes people may choose to do a placement in a major city, but it might be a really large city like London, just saying, or indeed, Buenos Aires or wherever.
Wherever.
And so the opportunity to have a different sort of experiences there. As a normal part of the medical program, no. That said, we're not talking little tiny hospitals. The Townsville is the largest hospital in our network, and that's one of the largest hospitals in regional Australia. It's the largest hospital in regional Australia, and it's a large hospital by national standards. But actually, Cairns Hospital, and so Townsville University Hospital, Cairns Hospital, and Mackay Hospital are both large hospitals too, and so the large hospital experience is also part of the core training of students at JCU.
And you did touch on it very, very sort of briefly in terms of the elective placement opportunities, but there was a question around pre-COVID-19. Was there many opportunities for students to undertake international placements as part of their study?
Indeed. And I probably hadn't explained it before, but actually, and assuming we get back into the normal world in the not too distant future, in the next 2 or 3 years, there has been standing structured opportunities as part of the program to, for instance, undertake not just an elective, but part of the course in Fiji, the Solomon Islands, and Sri Lanka. and you won't be surprised to realise that they're interesting tropical countries sort of a low or middle income country settings, and that provide people with opportunities to pursue things that are clearly going to align with the course. And so that's part of it. But again, as I said before, people can pursue electives overseas, and probably about in the final year of the program, I'd say about half the students choose to do an elective in different parts of the world. I still can't believe that at the beginning of only last year, we were trying to think about how we could still keep that going whilst the COVID pandemic was, what were we thinking?
Unfolding.
We just didn't really quite understand how big an impact it was all going to have. None of us, I suppose. But
no.
That we're anticipating that will come back again once international travel's restarted and the rest of it. And we'd be fully anticipating, certainly by the time people get to 6th year of the course, that would be all back to, if not exactly the same as before, something somewhat like before.
Excellent. Was a question around RPL, so recognised, obviously prior learning, particularly say if they're coming from a health area. This one in particular is a rural paramedic, and just wondering, will they get much credit for that prior study?
It depends. It's looked at in detail, so it depends a bit on the course. So thanks for the question. Oftentimes the answer is no, and although and let me explain why. So because of the integrated nature of the program and the academic weight. So for instance, in fairly heavy load programs like medicine, dentistry, or veterinary science, to give people a lot of RPLs, called recognition of prior learning, or advanced standing, the other piece of jargon, means that we're saying what you've done is equivalent, and now you can just jump straight into the 2nd year of the program or the 3rd year of the program, and we'll give you credit. What happens though if you do that without being thoughtful is that actually people might then crash and burn in the 2nd year because they don't have enough of the underpinnings. And whilst that you then repeat 2nd year, and you might argue, well, you're still then going to be at the same spot as what you would have been had you come into 1st year. But I can tell you now, it doesn't feel the same, because it feels like you haven't made the cut or something, and it has an impact upon people. It doesn't build confidence, and so oftentimes we'll look at it carefully on the merits, and including how well people have done. But oftentimes it's a much better idea to do the whole thing and then have success rather than try and cut a corner and shave a year off a medical degree. And because people will often come a cropper, as our experience in that regard. Also, because of the distinctiveness of the program, there'll be Aboriginal and Torres Strait Islander health systems science, early placement experiences, which a paramedic background won't be a problem with in terms of clinical skills, but perhaps there hasn't been those other things, health system science, Indigenous health, and rural health, and you'll have missed out on that, and then have to make it up on top of everything else in a pretty challenging 2nd year, and again that can be a challenge.
Great. There was a couple of questions around sort of accommodation on campus, and is that available, and is there sort of support available financially for students? Obviously, for those that aren't aware, I'd encourage you to visit the scholarships page on JCU website. There's a huge range of options, and you just have to have a look and see what is available to you. In terms of medicine students sort of going out on placement, is most of that sort of funded by the student?
So we recognise that, for instance, on the short placements, it's not fair for people to, let's say, here's a typical track that people might, particularly those coming in from, let's say, high school, mature age may be different, but high school, oftentimes people may say, well, look, I don't really know anyone there, mum and dad are a bit worried about because I'm just going to be moving out of home, it's often a common story. And so going into a residential college is quite a common choice, and there's certainly plenty of that, Tara, as people would imagine. But then by the time you get to the end of the 1st year of that, it's fairly common for people to say, look, I've done that was quite fun, but now I've got a bunch of friends and we're going to get a share house.
Even more fun.
That's right, and mum and dad have got used to all of that by now, so maybe that's going to work. Now, look, we wouldn't expect people to give up their spot in college or their share house to go and do a 4-week rural placement. And we also recognise it's going to be a bit unfair if you've got to pay full rent in Longreach, for a house. And so we, in fact, have accommodation in our small towns. And whilst there's a very modest contribution to that we expect students to contribute, it's very small. It's a token to help cover, the niceties, bit of milk in the fridge and tea on the
counter,
top,
yeah.
and the counter, and some toilet paper. The essentials. Just saying. So it's not an impost. Now, in later part of the course, when people, for instance, might uproot and move, say, to Cairns, we would be expecting that at that stage I was saying, look, I'm going to be giving up my share house or my college because I'm going to be moving into a share house or a flat or something in Cairns. But by that time, people often a bit more confident. They might have a part-time job, etc. We also do really understand people often working, and a lot of people in our program, say in the medicine, dentistry, where in other areas, people might, you'll have students who perhaps have wealthy, more affluent or professional backgrounds. Where many of our students are first in family to university, and we think that's great. And we understand that sometimes people's means be a bit humble. And so we really understand the need for people to be serious about accommodating some part-time work whilst also studying and being successful at both. Hopefully also having some time, Tara, for recreation, a sports club, and some personal interests.
Volunteering, that was another question that came through. Are there opportunities for students to volunteer? Yeah. And I think I'll take the opportunity to also mention that we've got this fantastic new accommodation facility opening here on the Townsville campus, hopefully if all goes well next year.
Boy.
It's very, very impressive. And then similarly in Cairns, I mean, I don't think I've ever seen nicer student accommodation. If you're on the top floor, you can see the reef on one side and the rainforest on the other. There's some hotels where you don't even get a view like that, so it's pretty special. Excellent. Well, look, I think that almost brings us to the end of the evening. And just would like to thank you, Richard, for your time. Thank you to everybody for joining us this evening. And if you've got any other questions at all, would really encourage you, again, jump onto the JCU website or reach out to the Future Students team. And they'll be more than happy to facilitate any questions that you have about any of the courses.
Can I thank you, Tara? And look, just to everyone, clearly a lot of this, a lot of fact stuff you can look up on the website. I hope I've given you a little bit of a tour together with you, Tara, across the options, but also the why. What is it about us, and what's it like to be here, and who are the sort of people students and clinicians and academics who are attracted to our university. And I hope I've given you a sense of that, and that's part of the understanding too.
Most definitely, and I didn't have the opportunity to say at the beginning of the presentation, nerves perhaps got the better of me, but I am a proud JCU alumni, and for those that are online, I would really encourage you to apply to JCU and consider it, and I can assure you from my own experience that you won't regret it, and you'll have a fantastic time. So thank you everyone for joining us.
Thanks, Tara. Thanks all.